Oh, should you take that statin? You were just prescribed a statin because your doctor told you you have high cholesterol. But on this channel, Vitalize Health Partners, we are just trying to educate you. What is cholesterol? Should you take the statin? Should you have another conversation with your doctor? Hi, welcome to the channel. I'm Dr. Andrew O'Connor, where health coach Erin and I try to educate you to live your best, well-informed, healthy life. So welcome to the cholesterol series. This is part 2, where we're going to be talking about when should a doctor prescribe a statin, and you as a patient, when should you take a statin? So statins, in my opinion, with my patients, I only use them if there is a risk of a heart attack or they have things in place that would put them for risk for a cardiovascular event. So it's not just me that thinks that. And why I bring that up is because there's a lot of patients that go to their doctor, because I know, because they come to me, and they have healthy lifestyle, they're at a healthy weight, they eat nutritious, healthy food, they've never had a problem, and all of a sudden their doctor comes back and says, whoops, there's one thing wrong with you, you have high cholesterol, but everything else is fine. And the doctor prescribes a statin. Why is that not a good idea? And it's not just me that thinks that. The U.S. Preventive Services Task Force actually has some guidelines for this. And we're going to go over that now. And I think a lot of doctors, and God love them. I feel like 99.9% of them are trying to do the right things for their patient. But I think some of them forget like the guidelines. I feel like you have a healthy patient in front of you. Should you put them on that statin? Let's talk about it. So the clinical guidelines, like I said, from the USPSTF, the U.S. Preventative Task Force, recommends statins for primary prevention only in ages 40 to 75 with one or more cardiovascular disease risk. So first of all, if you're under 40, you have high cholesterol, you have nothing else going on, where you put on a statin, you need to listen to this. Okay, and have another discussion with your doctor, for sure. So if you're the ages between 40 and 75, so not just the age, you also have to have a cardiovascular risk. And so that means, do you have diabetes? Do you have high blood pressure? Are you a smoker? Yeah. And not only that criteria, you also have to have a 10-year cardiovascular disease risk of 10% or higher, where benefits outweigh potential harms like muscle pain or liver issues. So the doctor has to be careful and only prescribe the statin if there's these other health risks involved, because you are risking harming the patient by giving them low energy, muscle pain, brain fog, leading to possible dementia-like symptoms and liver issues. I mean, like I talked about on my first video, if you haven't seen it, it goes into why cholesterol is so important for our health. Okay. So now for individuals with a low 10-year cardiovascular risk, so that means below 7.5 to 10%, evidence shows limited net benefit from statins. And actually, the risk of adverse effects from statins may exceed the small reduction risk that you get from possibly having a heart attack. That's why it always blows my mind when I have a very healthy patient in front of me. All their blood work is great, but their cholesterol is high. And their doctor told them to get on a statin. And I'm like, hold the phone. We got to go over. How's your blood sugar? We're going to look at a blood sugar, an A1C. We'll look at your insulin. We're going to take your blood pressure, not just once, but 3 different office visits. And I'm going to have the patient suggest taking their blood pressure at home, because sometimes there's white coat syndrome. You go into the doctor's office, you're super nervous, your blood pressure goes through the roof, right? So you have to be advised of that. I'm going to kind of work with them on reducing smoking and why your lungs, if we catch it, I don't know, probably if it's been 10 years, can the lungs improve? They can. The lungs can improve. Now, some of the cells won't come back, but you can clean up the lungs if you stop smoking. And can we correct some of the hypertension? Okay. So get this. The American College of Cardiology and the American Heart Association guidelines categorize risk levels and advice, get this, they advise against routine statin use in healthy adults. Again, I'm going to repeat that. The American Heart Association and the American College of Cardiology does not recommend statins in healthy adults. Did you know that? Listen, your doctor may not even know that. They probably are trying to do the best by you in putting you on this. But you need to be aware of these guidelines and these risks. So they also say that without elevated risks, emphasizing lifestyle interventions should be the first thing you do in borderline cases. So that's when you have a healthy patient in front of you. The only thing wrong is high cholesterol. Now you've got to go into lifestyle interventions. And I will talk about that on another video. Okay. So then in low risk populations, so look, we've already talked about that, the 10-year risk below 10 to 20%, trial evidence and guidelines indicate statins do not significantly reduce overall mortality or risk of death of cardiovascular disease events enough to justify widespread use of statins in otherwise healthy people. Yeah, that is what these trials and studies are saying. Did you know this? Does it make you feel better about your decision now going forward with statins? Yeah. Now, statins are more appropriate. There is a role for statins. There for sure is. Statins are more appropriate for secondary prevention or for high-risk primary prevention as broad application in healthy individuals that could lead, well, let me restate this. Statins are more appropriate for secondary prevention. Okay, so when you have a patient with a lot of these risks for cardiovascular disease and heart attack, or you're trying to prevent a high-risk patient that walks in the door. Okay, but as broad application in healthy individuals, this can lead to over-medication without any proven benefits. Yeah. So that is just probably, I think, the most important thing to understand about statins, that there are these guidelines, and it might make you feel better about that cholesterol diagnosis. Because if you're generally healthy, yeah. And, and what studies have also showed to reduce cholesterol naturally. I love it. There's a B vitamin called niacin, which has been shown to reduce LDL. We do get concerned about high levels of LDL because it could contribute to plaque formation in our blood vessels. Regular exercise and fiber. I mean, those are the top three things I always talk to my patients about on enjoying a more healthy lifestyle and getting that cholesterol down. So I hope you think this was helpful in your decision on taking a statin. And on our next video in our cholesterol series, we're going to talk about how cholesterol will keep your brain healthy, because nobody wants to get dementia, right? And what happens if you have genetically high cholesterol? Yeah, that's on part 3 of the series. Thanks for being here. See you on the next one.